Okay. Good morning.
Good morning, sir.
Today we will see about joint mobilization. So joint mobilization is one of the exercise therapy intervention or exercise therapy procedure which is used for a therapeutic purpose. Okay. So in which case we can use joint mobilization? So joint mobilization. So mobilization means movement giving in the joint. So when and all we will give the joint mobilization means when patient having any stiffness or contractions over the joint. Okay, so joint will consist of two articular surfaces, so or two articular bones. So இவ ரெண்டு போன் சேர்ந்தா ஜாயிண்ட். ஸோ அந்த ஜாயிண்ட் ஆகிற இடத்துல ஏதாச்சும் ஸ்டிஃப்னஸ் இருந்துச்சுன்னா, ஸோ எனி பேத்தாலஜி இருந்துச்சுன்னா, இட் லீட்ஸ் டு limited in the range of motion or pain over the joint space. So for that we will give mobilization technique. So joint mobilization consists of gliding, sliding, rolling. Okay, so these are the basic principles in the joint mobilization. So in that we will see about the shoulder joint mobilization technique. Okay, so patient having right side frozen shoulder. Assume that patient is having right side frozen shoulder. So what are the movement will be involved in that right side frozen shoulder? Patient will have difficulty in flexion movement and then the abduction movement and also internal rotation movement. Okay, so patient will tells about the complaints of I can't able to I have difficulty in my dressing activities. I have difficulty in combing my hair. I have difficulty while bathing. So like that, patient will complain about the complaints to physiotherapist. So we have to give the therapeutic mobilization to the shoulder joint so that patient will gain the range of motion. Once the patient gain the range of motion means his problems will become resolved. Okay, so in shoulder we have to give three types of gliding techniques. Okay, so one is the posterior glide, one is the inferior glide, one is the anterior glide. So first we will see about the posterior gliding technique. Okay, so in this shoulder joint there is a two articular surface. One is the humerus, one is the scapula, inner scapula, glenoid, labrum. Okay, so in this glenoid will be fixed one. We are giving gliding only to the humerus. So one articular surface is fixed one. We are giving gliding technique or mobilization technique to only one articular surface. So in shoulder we are giving gliding over the humerus. Okay, so therapy should be applied gliding over hypothenar muscles with the help of hypothenar muscles. So we must give a glide over the humerus with the help of hypothenar muscle and we have to give pressure. So like this we have to give a glide for 20 to 30 repetitions. Before that we have to tell the patient having any discomfort or uncomfort, any pain. So the patient want to tell to us so that we can stop and then we want to know what the reason behind that. Okay. So in these lines understand which type of glide is posterior glide. So it is to improve flexion movement. Okay. So in this mobilization there is a two type of mobilization. One is the Maitland one, one is the Mulligan one. So what I am now doing is the Maitland mobilization. So in Mulligan mobilization, what the Mulligan saying is we have to give a movement along with the glide. So movement with the gliding. Okay, so both will increase the range of motion. So this glide is a posterior glide is to improve the shoulder flexion movement. Similarly, we have to give inferior glide, so which is to improve the shoulder abduction movement. So this one is the Maitland technique. So this one is the Mulligan technique. So movement with the gliding. Okay. So similarly, for this technique is used to improve the abduction movement. Similarly, we have to give for extension, the shoulder extension. For that, we have to make the patient in the prone lying position. Similar to posterior glide, we are giving the anterior glide. It is to improve the shoulder extension. So make that say Mulligan. Okay. Comes. So this is the gliding technique and mobilization technique for shoulder joint. Okay. So which will increase the shoulder movements. So like that we have to see each joint mobilization. So understand?
Yes, sir.
Any doubt?
No, sir.
Okay. Thank you.
Yes, sir.
Yeah,